Hi, welcome to Eduwizz Academy. This is a demonstration video which has been taken with an intention to make awareness in candidates who is preparing for their Prometric as well as other nursing licensing exams. This video is focusing on making the candidate aware about how he or she should prepare the theory part of the course or theory part of the exam. Now, we here in the Eduwizz Academy is providing online coaching which is mainly focused, or we give prior importance for exam oriented topics. We have formulated the syllabus in a way that it meets all the demand of the candidate who is preparing for the exam. It's not that we are just taking many disease conditions, we are just taking the management of all the disease conditions. It's not like that. The syllabus is formulated in a standard way which is in relation with the exam asked question, the question that has been asked for the exams. Now, you can study the disease condition in two ways. The first way is that you can study each and every detail of a disease condition or a topic. You can study A to Z things in that topic. That is one way. Or you can study a topic or disease condition which is concised, or which we have concised to a level that by only studying that much of the portion in that topic is enough for preparing the exam. Now, this is the two ways. Now, what we suggest is a second way, because it's not necessary to study each and every point that comes in the topic. We want to just pass the exam, or we want to clear the exam. For that, in fact, you have to study the topic, but study the topic in a way that it meets the demand of your exam, not to increase your intellectual things in that topic. That is not our objective. Our objective is to make you enough confident to face the exam by studying all these topics that we are providing. Now, one such topic which I have selected here is what I am going to present before you. This topic is very important because for all the nursing licensing exam, one or two questions comes from this topic. Now, let us straight away get into the topic. The topic that we are going to discuss here is cystic fibrosis. Now, the cystic fibrosis you might have heard, many have heard, isn't it? Some when we have studied our bachelor science, or when we have studied our nursing science, we must have come across with this word. Now, we are going to discuss only those points from cystic fibrosis which has come for the exams already. First, we will start with the definition. In fact, you have to have a basic knowledge first. For that, I have included the definition here. Now, let us see the definition first. An autosomal recessive disorder affecting the exocrine gland, resulting in the production of thick secretions from these glands. This is a definition. Now, you can by heart this definition, or you can understand the definition and study it. Now, let us understand the definition and study it. That is good. Now, by seeing this definition, you may have doubt on two words. One is autosomal recessive disorder. Next is exocrine gland. Without knowing the meaning of autosomal recessive disorder and exocrine gland, it is waste of studying the cystic fibrosis, isn't it? So, let us see the meaning of autosomal recessive disorder. For a human being, there are 23 pair of chromosomes. 23 pair means 46 number. 23 from mother and 23 from father, that makes it 46. 46 number of chromosome or 23 pair of chromosome. One pair is equal to 2. So, in this 23 pair of chromosomes, there are two types of chromosomes. 22 pairs of autosomal chromosome and 1 pair of sex chromosome. Okay, out of this 23 pair chromosome, total 23 pair chromosome, 22 pair chromosomes are known as autosomal chromosome and 1 pair of chromosome is known as sex chromosome. Now take that 22 pair of autosomal chromosome. So cystic fibrosis is something that is related with this 22 pair of autosomal chromosome. Autosomal chromosome. Okay, now you understood the term autosomal. Okay, now let us see the word recessive. Now, in this 22 pair of autosomal chromosome, each pair contains 2 chromosomes, isn't it? And each chromosome contains 2 copies of genes. 2 copies of genes. That means one gene has come from the mother and the other gene has come from the father. That makes it 2. Okay. So, each chromosomes in the autosomal pair of chromosomes contain 2 genes, 2 copies of genes. One gene came from mother and the other gene came from the father. If both these genes are having abnormality, that can lead to disease. And that disease is known as autosomal recessive disorder. Because both the genes from the mother and father is abnormal. That is the meaning of autosomal recessive disorder. If suppose only one gene is abnormal in the chromosome, if only one gene is abnormal, that results in carrier. The baby will be carrier. The baby will not have a disease. Rather than having disease, he will be a carrier. But he can pass the disease to his next generation. He is having the capacity of that. Now, hope you understood the meaning of autosomal recessive disorder. Autosomal recessive disorder are those disorders in which both the genes in the autosomal chromosomes or both the gene in any one chromosome of the autosomal chromosomes will be abnormal. Okay, so that is autosomal recessive disorder. Now coming to exocrine gland. Exocrine glands are those glands. In fact, for a human being, there are 2 types of glands. Exocrine gland and endocrine gland. Now let us see what is endocrine gland. Endocrine glands are those glands that produces hormones in our body. Glands that secretes hormones are known as endocrine glands. Now coming to exocrine glands. The glands that produces secretion. The glands that produces body secretions are known as exocrine glands. Now what all of this exocrine gland? Can we tell some example of this exocrine gland? Salivary gland is an exocrine gland because salivary gland produces the secretion saliva. Lacrimal gland is an exocrine gland because it produces the secretion tear. Sweat gland is an exocrine gland because it produces the secretion sweat. Lungs is an exocrine gland because lungs produces the secretion mucus. Pancreas is an exocrine gland because pancreas produces pancreatic juice, that is a secretion. Pancreatic juice which helps in the digestion. Now let us connect this. An autosomal recessive disorder. It's an autosomal recessive disorder. But this will affect which body part? This will affect the exocrine gland. Now what happens to this exocrine gland? That is being stated in the next sentence, resulting in the production of thick secretion from these glands. Now the secretions that have been produced from this exocrine gland become thick, become more thick or copious, or become very cheesy, very thick in the condition cystic fibrosis. Now what happens if the mucus produced by the lungs become thick? It will result in airway obstruction. Now what happens if the sweat become thick? The sweat become more concentrated, which results in excessive loss of sodium and chloride from our body. Now what happens if the pancreatic juice become thick? That results in indigestion. The food cannot be digested properly, isn't it? So these are collectively known as cystic fibrosis. Even if it is only affecting the exocrine gland, the result is shown, or the result of this is being seen in many organs. That is why it is also known as multi-organ disorder because it affects multiple organs. Cystic fibrosis affect multiple organs like lungs, pancreas, gallbladder, airway, sweat gland. Many organs are being damaged or dysfunctioned in this condition. So this is what the cystic fibrosis is. Now let us see the clinical feature of this. The main clinical features are hyponatremia. Why hyponatremia occur in a cystic fibrosis patient? This answer is simple. As we have mentioned earlier, the sweat will become more thicker, sweat become more concentrated. Now what happens in the concentrated sweat? The concentration of sweat is due to the presence of sodium and chloride. Now increased concentration of sweat means increased concentration of sodium and chloride. If sodium and chloride concentration increases in the sweat, indirectly you can say that sodium and chloride is being lost from the body. If the sodium is lost from the body, it can lead to hyponatremia. Now the next feature is airway obstruction. Why? Why airway obstruction occur? It has also been mentioned earlier. Because the mucus secretion that is produced from the lungs become thicker. What happens if the mucus become thick? It will get congested in the airway tract, which results in airway obstruction. And it can lead to other opportunistic infection, respiratory infections. And next feature is indigestion. Why indigestion occurs? Indigestion occurs because pancreatic juice is thick. If pancreatic juice is thick, digestion process will not happen properly. That can lead to digestive problems, indigestion. So these are the three main clinical features, but here I am going to tell you the question that has come from this related to the clinical feature. They have asked, what is the priority nursing diagnosis for a cystic fibrosis child? The priority nursing diagnosis, you should give first emphasis on airway. When you are setting the nursing diagnosis, you should give first emphasis on the airway. Now airway related feature we have already mentioned, airway obstruction. So if a patient is having airway obstruction, his airway clearance will be ineffective, obviously. So the nursing diagnosis for a cystic fibrosis patient is ineffective airway clearance due to this airway obstruction. So that is a simple question that we have got from the cystic fibrosis topic. Now let us see the management. Before going to management, I want to tell one more extra point here. There is a diagnostic test to find out the cystic fibrosis, and that test is known as sweat chloride test. You are assessing the concentration of chloride in the sweat. So the normal concentration of chloride in sweat is 40 milli equivalent per liter. 40 milli equivalent per liter. If the chloride concentration in sweat is increased, or if it is above 40 milli equivalent per liter, it is suggestive of cystic fibrosis. So that is a simple point, you can remember that. So sweat chloride test is a diagnostic test for cystic fibrosis. In this test, you are assessing the concentration of chloride in the sweat. Now the normal concentration of chloride in the sweat is 40 milli equivalent per liter. If the concentration is increased, if the chloride concentration is increased above this 40 milli equivalent per liter, that is suggestive of cystic fibrosis. Now let us see the management. High sodium diet is given because in clinical feature it's mentioned clearly that the patient is having hyponatremia. So in order to manage that, you have to provide the patient with high sodium diet. Bubble blowing exercise. This is another question that has been asked from this topic. The question is, which type of respiratory exercise is given for a cystic fibrosis patient? Now as we have mentioned before, a patient is having airway obstruction. So you have to give exercise in order to clear the airway. The main rationale behind giving exercise is to clear the airway of the patient. Now in order to clear the airway of the patient, the best exercise given is bubble blowing exercise. The patient is made to blow the tube and make the bubbles. By blowing the tube, gradually his airway get cleared up. So that is the exercise which we suggest for cystic fibrosis patients. Now the next management is pancreatic enzyme with each meal for indigestion. So as we have mentioned in the clinical feature, there will be digestion problem because this pancreatic juice is very thick in nature. So in order to make this digestive process you have to give pancreatic enzyme with each meals. Now this pancreatic enzyme is given within 30 minutes after taking food. Okay, that time is within 30 minutes, 30. It should not go beyond 30 minutes. After taking food, within 30 minutes, pancreatic enzyme should be administered. So only the digestion process will happen normally. Okay, so that is a point. Now, this is another question that has come from the cystic fibrosis topic, that is weekly weight checkup to be done to revise the dose of pancreatic enzyme. Now, you are calculating the dose of pancreatic enzyme according to the weight of the patient. Now, if you want to make any change in the dose of pancreatic enzyme, you have to first check the weight of the patient. So, weekly weight checkup, weekly basis weight checkup is done to revise the pancreatic enzyme dose. Now, the question that has come from this point is that a child diagnosed with cystic fibrosis need to revise the pancreatic enzyme. Now, which among the following the nurse should consider as a priority assessment to revise this pancreatic enzyme? That is the question. Now, what is the best assessment that can be done? The assessment done is the weight, because it is according to the weight the dose of the pancreatic enzyme has been calculated. So, that is a point that has come from the cystic fibrosis. Now, we got 3 question points from this topic. One is the nursing diagnosis of cystic fibrosis, ineffective airway clearance. Second point, the exercise that is provided for cystic fibrosis patient, bubble blowing exercise. The best indicator to assess revision of pancreatic enzyme is weekly weight checkup. 3 points you got from this topic. Now, we have concised this topic in order to focus these 3 points. So, this is how we have formulated every topic that we provide in our online coaching. So, hope you understood the topic cystic fibrosis, and thanks for watching. Thank you.